I'm Dr. Tony. I'm a chiropractor. Okay, what I do is I adjust people's bodies all day long. Okay, my biggest thing I do is a health educator. Even though we saw 59 people this morning, 3 hours, my partner and I, boom, we rock and we get to go. A lot of it is how do we make sure people understand why they're coming in? How to not just take away their pain, but also make them overall body healthy. My thing is not just we're going to help your pain, and I had some come in bad sciatic pains today. We adjusted them, we took their x-rays, we walked through what was going on, but I want to understand why. Because my thing is the pain didn't happen spontaneously. Okay? Usually lifestyle issues, injuries, trauma, car accidents, we get everything in our office. But can we get people to understand is if we're healthier, our risk of injury is a lot less. And what does health include? A lot of it for me is health is yes, nutrition, a positive attitude, but also physical health. I focus on that. I want people to not be just pain-free, but also want them to be strong in whatever they want to do. Maybe biking, hiking, CrossFit, weights, yoga, whatever it is, so they have a routine to keep themselves healthy. Okay? The way I do that is to send my patients videos, exercises. I walk them through how to exercise in the office. So I don't say you don't have to see a PT, physical therapist, or a trainer, but can you start here? A lot of people, this is 2021, right? Does everyone here kind of work out a little bit here and there? Go gym a little bit? So maybe not so much. But we know about the gym. We know what the gym is, right? We know what treadmill is. We know what things are. Some people, 2021, don't know what it is. They've never walked into a gym before. They've never gone somewhere or understood what physical health is. So my job is see wherever they are in that pendulum of education first, and then bring them closer to. So my job is to make sure over time they know enough information, they have enough videos from my office, they understand what my goal is with them to do. At that point, lead them on their way. I want to make them their best doctor. Okay? By doing that, we're more as a chiropractor, maybe an osteopath, a DO, or an MD, is our primary goal, even though it may not be our job, is to be health educators. When we do that and we think about that as a whole, how do we do that? I do these talks, I do videos, I do testimonial videos, I do anything I want to do. I put about 4 or 5 videos out a week because I want people to understand what health is. Maybe not just chiropractic, but health in general. So when I do that, a lot of it is I want to train my patients to become their best doctors by learning about, okay, if I'm going to get healthy, I have to feel something called uncomfortable. Okay? If you ever worked out before, you're going to feel a little sore, uncomfortable, achy, tired. Sometimes it's going to feel like, Who took a break if you worked out before during COVID? Who stopped working out? That's when I started. There you go. So someone started, but if you stopped and try to go back being someone who's 47 years old, it doesn't feel good. It feels like, okay, I'm waking everything up again. I feel like I worked out beforehand, and when COVID hit, all the gyms closed. So at that point, I'm working out at home with my wife's 5-pound pink weights. That doesn't do a lot. You just have to count. You go, was that on 15? Was that on 20? Where was that? I don't know. So my thing is, okay, once I got back to the gym, how to get healthy, I went back to the weights. Good, it hurt for a while too. You know, my buddy opened his gym up. It's his birthday day, actually. Happy birthday, Fernando. A lot of it is he opened a gym. He opened a CrossFit gym at his house, and CrossFit/HIIT. The first week I was there, I thought I had COVID for 5 days in a row. It sucked. It hurt. But I knew how to get through that to now feel good and now have a different type of health versus what I had before. Okay, does that kind of make sense? So if we can get healthy and stay healthy from chiropractic perspective beyond everything we're talking about today, we have to understand if we're going to be in healthcare, maybe a medical doctor, a chiropractor, podiatrist, whatever it is, at that point you have to educate your patients well and have certain manners to do that. Take my patient, educate them. What's the number one thing they have to be able to do? They have to understand that I care. I care about their health. Okay, so when they tell me something, I have back pain, I'm going to listen to them. I'm going to mimic how they're going to sit. Okay, there's a thing called like attracts like. When someone sits like this, they're doing this the whole time. I'm going to sit like this, like they are. Why do you think that is? They're doing this. They think subconsciously, this person's like me. So at that point, I'm going to maybe hear what they're saying. Maybe over time, apply what they're saying. Maybe understand why I'm here, how they're going to help me. So it doesn't just not just your posture, but also your tone of voice. Does that patient in front of you, do they have a tone of voice that, say, for example, they speak slowly? Do they speak at a high tone or a high volume or low volume? There are certain things that they say during their talk when you're interviewing them as a patient that you want to repeat back to them. For example, someone says the word, instead of saying sciatica, which is leg pain from the lower back down the leg, sciatica, they say the word sciatica instead. That's their pronunciation of the word. I'm going to use that word a couple times with them. The reason is you use that same terminology because they already know what that in their head what that means to them. They said, I have burning pain that goes here. I'm going to repeat down the line, burning pain. Because when they said that, they had an emotion attached to it. So at that point, they're going to connect with what you're saying to get them to progress to the next step. Maybe in my office taking an x-ray, maybe doing an adjustment, maybe doing therapy. So that when they see the benefit of that. Okay, any questions about that? So when you're the patient, maybe one being internship or doing, for example, residency too, how do you get them to understand you? For example, my grandmother had to go to the hospital a couple years ago at UCLA. UCLA is a big school, right? They're pretty good, whatever it is. They're not a community school. They're not the clinic down the street. So they have interns come in. And the intern is telling my grandma, who's in pain, she's 91 years old back then, about their schooling, about what year they're in, and about how their schooling is rough on them, why they're here, why they're doing the residency at UCLA Medical School. In my head, I'm going, my grandma doesn't care about that right now. Can you help with their pain? It's funny, right? But they come into the emergency room, they're going about them, not about what's going on with the patient. So the nurse is going like this, like, here comes another intern with the same information. So can you be different and be there with the patient the whole time? This one, I saw 59 people this morning. I had 2 new people. I spent, also with my patients. In the room, boom, I'm with the patient. I had their chart in front of me. Hey, Carlos, what's going on today? I saw you have this, and this. You want to make sure they know you're looking at them, you're talking with them, you're understanding them. Because people come to see a chiropractor, some people have no idea what we do. Do you think chiropractors give medications out? Prescribe medications? No? Maybe? No? Good job, good. Let you guys know. People come to me, I get some Darvocet meds, some Percocet. I'm like, I don't do any type of sets. I do weight sets, that's about it. But a lot of it is, can we go, okay, people don't know what we do, how do we get them to understand what we do, maybe whatever field it is, but also understand more importantly how to help them. Okay? My biggest thing when I'm with a patient for the first time, because sometimes you have to make a first impression with a person. With anybody. Sometimes you make a first impression. How many times? Basically once. One time. So my job is with them. I want to have the impression like, hey, I'm here to help you. It may be the manners we talked about, the like attracts like, maybe tone of voice, maybe how your posture is. The number one thing is going to be, can you look at them in the eye? Can you look them in the eye and go, hey, I'm here to help you. Looking at your situation, what you told me right now about your back pain, for example, is what's going on. You've had it for 2 weeks. It's burning down your leg. It's causing your ability to sleep. Let me help you with that. Let's go take an X-ray. In my sense, let's go take an X-ray and find out what's going on. And like you're doing right now, sir, I'm going to do the same thing. When I ask them to do something, I'm going to do this. Why is this important?
Your acknowledgement.
Your acknowledgement, and you're getting them to buy in to what you've asked them to do. So I go, let's go take an X-ray right now, find out what's going on, and I do this. They're going, okay, let's go take an X-ray. I'm like, Jedi mind tricks. Because it works. Okay, my son a couple years ago, he went to go, out of high school, went to go apply at Barnes & Noble. I don't know if they're still around or not. And I said, whenever you give information to them, and they ask you, do you want the job here? You go, yes, I do. You nod your head, yes. They go, okay, let's hire this guy. It's little things you can do to get someone unconsciously, because you're helping to help them, right? To buy in and let them help you. Let you help them. Okay, any questions about that? Nothing? Yeah. A lot of what I do too, with my interns in my office, I want them to follow me out to the shadow room. Because when they see that interaction all the time, they see how I present with patients and how I talk to them, how I shake their hand, how they know their name. That's important to them. When you talk to someone, you're in a crowd, and someone says your name, do you automatically go, hey, are you talking to me? No, right? Because maybe you have an uncommon name, I don't know. But when someone says your name and they say it over and over again, you're acknowledging again that you care about that person. My staff should, for 90% of the time, When someone walks in the door, if they've been there for the second, third time, know the person's name when they walk in the door. Not to look at the sheet and go, hi, Mrs. Sally, how you doing today? What's going on? It should be, how you doing? What's going on? We saw you a couple days ago. How you feeling today? Why is that important? What do you think?
Makes the patient feel more comfortable.
Exactly. Shows that you care. Shows that you care. That's my go-to. If you can make them comfortable, if you make them feel at ease, make them feel that they can trust you, then they show that you care. You want to be able to care for the patient. At that point, you can help them over time. Makes sense. So whatever you're going to use, whatever your strengths are, maybe tone of voice, maybe mannerisms, maybe vocabulary, maybe whatever it is, can you also, right now it's kind of hard, but can you smile at them? Does that help everybody? I did commencement speeches for ROP program, for high school too, and part of their medical assistant program. A lot of it is pre-mask. Can you show that you care by smiling at somebody? When you smile at somebody, go, hi Sally, how you doing today? What's going on? And you smile at them. Even if it's very subtle, at that point they go, good, how are you doing? When you smile at someone, what does someone normally do back at you?
Smile back.
Smile back. Simple things. Okay? By doing that, you show that you have a connection with that person. And maybe just something subtle, but you want to make someone feel in your office or private practice or the hospital, make them feel wherever their tension is here, make that tension calm down a little bit. And if they're talking really fast but they're anxious, calm them down a little bit. I may start at their volume or their speed of voice and go, hey, yeah, that makes sense, blah, blah, blah. Let's see what's going on now. And drop it down just one notch. And see if they buy in. Pause a little bit between words. Who talks faster? I do, sometimes. I start just boom, boom, boom. When you slow it down, when you change your tone of voice, your speed of voice, people go, what is that? What just happened? And they pay attention just a little bit more. So use your different techniques you can use, maybe from here or somewhere else too, to learn exactly how to help someone, again, show that you care by building that trust with the person. People will not listen to you, how you want to help, especially if you're younger, if you don't build that trust first. At that point, you have to be able to build that trust by getting to their level of comfort. And like we talked about a second ago, that like attracts like. So you feel comfortable. I've been in practice for 20 years now. It runs well. It's a machine. It's easy. I'm 47 years old. So people think I'm smart or something. I don't know. I don't even use like three-letter words. I'm like three-syllable words. My God, those are impossible for me. But can you get someone to, whatever experience you have, gain that by really honing into showing that you care? And how do you become an expert? What do you think? In your field or field you want to get into. What's an expert to you? Experience. What else? Two things.
I'd say like having something unique to contribute that only like you have.
Mm-hmm. A special one.
Yeah.
Okay. I'd always go back to knowledge plus experience. And if you're in healthcare, it's certified knowledge plus experience. You have to get a license in something. Don't let you go and practice because you want to practice. Okay? So when you're accountable, when you have the knowledge, a license, and experience, that gets you to become the expert, and people will trust you. Make sense? When I came in practice when I was 20 years old, I lied about my age. I told people I was 32. They're like, like, sure, whatever. I had a friend of mine, actually my mentor, he was so young in practice, he actually wore fake glasses to look older. Is that crazy? But did it work? Yeah. People like, okay, he's been around for a little bit. Understands stuff. People still ask me, how long have you been in practice for? I go, 20 years. They go, okay. I'm like, dang, it's a long time. You know? But can you practice long enough that people go, okay, that makes sense. People have expectations to make you their expert. It's not about you. It's about them having expectations. So maybe 5 years, maybe some gray hairs, whatever it is too. Maybe a certain way that you dress, a certain way that you walk, a certain way that you talk. So can you find that expectation that lets them buy in so they shake their head, okay. Now they'll listen to you. And what gets you that experience faster, you think? Talked a little about it earlier, right before we turned on the cameras, so the world can see. What gets the experience a little bit faster? Versus just being in school. Volunteering, internships. That's the key. I started volunteering as a chiropractor, become a chiropractor. Chiropractic school is about 10 semesters. I started volunteering my first semester. I said, I'm going to do this. Where am I going to work? Who am I going to work for possibly, or work on my own practice? How does this work? You don't go to school just go to school, right? You're not a lifetime student. I mean, they don't just go, after being here for 5 years, you're free. Don't do that. You know, we want you to graduate and do something else. If I'm going to graduate, where am I going to go next and how to get experience there? I started volunteering a year or first semester after I graduated, or before I graduated. That one allowed me the experience when I actually graduated. I already had a job lined up. I was already working there as a assistant, chiropractic assistant, and then as a chiropractic full doctor once I got my license. So I had a job. People that I graduated with, it took them 6 months to a year to find a job. So when you're not working, no one's paying your bills, then what do? Then you panic. When you're looking for a job, this is just in general, and you don't have a job, are you able to get a job easier or when you have a job? When you have a job. Now's your job is to volunteer. That's your job. Not paid at all, but giving them, if you want to call it your time to benefit that practice, that hospital, that internship, even as a scribe to it someone had mentioned. Getting out there and doing that allows you to gain that experience and that reputation too. Being an expert, you build a reputation. When you volunteer, you have a reputation over time with those people you work with. So spend the time. I have interns come in for a full semester, usually even a quarter, even a couple weeks too, sometimes based on their availability. At that point, as they're working, their volunteer gives them experience. So when they come to me and go, I'm applying for this school, I'm applying for this job, they get a letter of rec. I go, of course you can. If I like them. If I don't like them, they're not going to be there very long. They're not going to be volunteering very long. I'm going to go, it was good, nice having you. Time for you to go. If you're going to volunteer, how should you dress? Professionally. Okay? I tell them, leather shoes, dress pants, and at least a nice polo. At least a nice polo. If you can't do that, I can't help you. Because you have to look the part, right? You have to look professional. You know, if some places that may not require that, okay. But find out what that is. What's the biggest thing when someone thinks about, if you want to call it, there's a book called Ancient Art of War. The biggest thing I got from that is do your recon. Do your research and just go sit in the office and go, what kind of people come in this office? What are the doctors dressed like? Some doctors, to be honest with you, they'll some wear a lab coat, some chiropractors, some wear Hawaiian shirts to work. I can't do that. My wife would kill me. So I'd want to see, okay, what's acceptable here? What's the margin? And how do I make sure I blend in and fit in? That point, once I fit in, then I can show my personality what's going on. Then I can go, okay, how do I now make myself known? How do I help everyone here? You may not be the doctor at the office or at the hospital, at the internships, but how do I show the staff that I care? How do I show the patients I care? When my interns are in my office for about a week or so, I have to start working with patients indirectly. Go, hey, go do therapy with this person. Take that person back to the back table. Their job in that meantime, in that process of seeing that patient, is learn the patient's name. Why do I think it's important for an intern? Why do I think it's important for an intern to get that learn the person's name? Why do I think it's important?
Because they're also representing the business, and so that patient needs to realize that even like the most low of the low on the totem pole is like caring about them.
Caring about them, communicating with them. When I have interns in my office that come out, especially in healthcare, a lot of people in healthcare, especially at the schools that I work with, have very low social skills. They have good book knowledge, they can pass all their classes, they can do that all day long, but their social skills are very minimal. So like exactly, when I have my interns talk to my patient, maybe for 5 minutes or so, just putting them on the table, ice pack here, maybe to walk them up front to the front office, set the next appointment up. I want them before they leave, everyone that I saw that they spoke to, I want them to know the patient's name. At that point, Sally, have a good day. Hi Sally, I'm John. How are you? I want to bring you back to the back table. You're all set? Any questions at all? No? Great, thanks. Have a great day. See you next appointment. Boom. It's a in my head, that's my script, but they have to say it over and over again. When you do something over and over again, that becomes comfortable. When you're comfortable, it becomes easy for you. Then you can show your own personality. How you talk, how you speak, to help them feel more comfortable too. My job before a patient leaves me is to feel that they've been helped, but also make them smile a little bit. Make them feel like that they're going to have a good rest of the day. On my business card it says, if it's not the best day of your life, why not pretend? We help someone feel that they're going to have a better day after they leave. That's my job. Any questions at all? Yes, sir.
So when you said like developing habits in like health education is a big part of your job.
Huge.
So when you get patients who come in and they have some sort of injury due to, you know, a habitual like posture
Chronic
issue,
thing,
let's
yeah.
say, yeah, something like that, or like they're just unhealthy due to something they do in their routine. And then you educate them, and then they come back later with the same issue because they just ignored your advice. How do you deal with that professionally? Like without just like making them feel like, I've already told you this, why aren't you doing it?
Nope, I go, hey, let's start from the beginning. I know you had a rough time. You may not have stuck right away. Let's start over. I give them gratitude as much as possible. I'm grateful for them to come back to my office, and I give them as much leeway as they need. Because everyone's life is different. You may be them for 5 minutes. He might tell you that they lost someone last week. They've had a rough time at home. They lost their job. So their life is going to change, but not around you as a doctor. So I'm going to go, you're here a year later. Yes, we talked about that stuff. Let's see where you are now. Let's start over. They go, thank you. Because they might not have been a year ago ready to hear it. They may have been immature. Their life might have been easy back. But now they're ready. It's about timing. Can you be there when they need you for their injury at that moment, for that day, for that time, for that year? You can't make it about it. So you got to go. When I'm here, I saw you last year, Jerry. At that point, yeah, we talked about this. You weren't able to do that. Let's start over again. Let's find out what's going on today. Now they're here. When they come back again, now they're willing to listen. Now they want to hear you. They've not been ready a year ago. I put stuff on social media every day, and I'm there because I want people to hear me when they're ready. To make that phone call because they saw that video last week. So you have to be sure you're ready when they're ready, not because you're there. But good though. A lot of people don't understand that. I have patients, a lot of senior patients, they come to my office and they're upset because they go to their doctor, and the doctor goes, well, I totally take the medication, but doc didn't work. I've sent physical therapy, but doc didn't work. They get mad at the patient because it's not helping them, even though they're not listening to the patient how they want to be helped. So you have to be able to, like I said before, be there when they're there. That's when the timing is about them, not about you. Good question. Any other questions? Anything else? Good. I see the next group's ready to come in for the, I don't know what they're doing.
Class.
Oh, God. Oh yeah, class. Oh God.
Let me just wrap up by thanking Dr. Tony for coming. And for my
Thank you.
students, if you guys learned so much in just, 20 minutes, imagine when you get to shadow and work in his clinic.
That's what I do.
How do we go about that?
Talk, Mr. Joon, that will set you up. At that point, I have people come in either like a Monday, Wednesday, or Friday for about 2 hours. Come in and just follow me around. Ask questions. I send people videos too, what to look for, and just learn the back. I call it the back office. The doctor-patient relationship is more important than it's not as more important. Once you're in practice, learn it faster that way. Find mentors that teach you. I didn't learn this stuff. I learned from a mentor. I paid someone thousands of dollars to teach me all of this. You get it for free. So if you want to pay me afterwards, you can. But I would recommend it. Any questions?
Thank you.
Good? Thank you guys. Appreciate it.